Have you noticed the signs that appear in elderly individuals up to a year before they pass away? It may be unsettling, but it is a reality that many elderly people exhibit noticeable physical and behavioral changes during this time. Initially, these signs may be subtle and easily dismissed as a natural part of aging. However, medical professionals have identified specific patterns that can indicate when the body is preparing for the end. In this video, we will discuss 7 key signs that often manifest in elderly individuals in the year leading up to their passing. From sudden shifts in weight to changes in behavior, these signals can provide valuable insight into what is happening internally. Understanding these signs can help families offer the appropriate support and care to their loved ones in their final months, ensuring dignity and comfort in this chapter of life. It is important to pay attention until the end of the video, as recognizing these changes can not only prepare you emotionally, but also allow for interventions that may enhance the quality of life. Whether you are concerned about yourself or a loved one, this information is crucial for everyone to be aware of. Now, let's delve into the first sign: sudden unexplained weight loss. One of the earliest and most concerning signs observed by doctors in elderly individuals before they pass is sudden unexplained weight loss. If an older person starts losing weight rapidly without making changes to their diet or lifestyle, it is often a warning sign. While weight loss alone may not always be alarming, when it occurs swiftly and without a clear cause, it could indicate a serious underlying issue such as cancer, advanced heart disease, or organ failure. In some cases, the body may struggle to absorb nutrients properly, leading to muscle wasting and weakness. For example, consider Richard, an 82-year-old man who lost nearly 15 kilograms in a few months without trying. Initially, his family attributed it to normal aging, but they soon realized he had an underlying condition affecting his ability to maintain weight. By the time it was diagnosed, his body had already weakened significantly. Weight loss in elderly individuals goes beyond just numbers on a scale. It signifies a deeper problem within the body's complex system. In addition to weight loss, a decrease in appetite often accompanies this sign. If a loved one starts skipping meals, feeling full faster, or losing interest in food, it could indicate a more profound issue. While the body naturally slows down as it nears the end of life, a sudden loss of appetite and rapid weight loss should not be ignored. Family members and caregivers should be attentive to subtle changes in an elderly person's appearance and behavior, as early intervention could lead to the identification and management of underlying conditions. Adjusting diet, adding supplements, or managing medications can help slow the decline and enhance overall well-being. If unexplained weight loss or increased fatigue and weakness are observed in an elderly individual, it is important to seek professional advice and take appropriate action. These signs may indicate that the person is approaching their final year of life, and addressing them promptly can improve their quality of life and well-being. Experiencing a more profound decrease in speed, fatigue in older individuals can arise from various causes. When approaching the end of life, this fatigue is often linked to declining organ function. For instance, the heart may not be pumping efficiently, leading to reduced oxygen and nutrient delivery to muscles and tissues. The kidneys or liver may also not be effectively filtering toxins, resulting in a buildup of waste in the body, causing a sluggish feeling. Additionally, the immune system may become overworked, constantly fighting off infections or inflammation, leaving little energy for other activities. Consider the case of 78-year-old Margaret, who used to enjoy tending to her garden but started experiencing fatigue and difficulty with simple tasks. Doctors often examine energy levels to detect any unusual patterns. If someone who previously engaged in light activities now prefers resting most of the time, it could indicate a deeper issue beyond just feeling sleepy. Chronic fatigue in the elderly is not solely about being tired. It involves losing the strength and motivation to carry out daily tasks, as the body struggles to maintain basic functions. Another critical aspect to consider is how fatigue impacts mood and mental clarity. Prolonged weakness can lead to disengagement from surroundings, increased daytime sleeping, reduced communication, and loss of interest in once enjoyed activities. This shift is the body's way of conserving energy. If a loved one displays these signs, it is crucial not to dismiss them as normal aging. Seeking medical advice can help identify underlying issues such as anemia, heart failure, or nutritional deficiencies, which, when addressed, can improve energy levels and vitality. Observing changes in an elderly person's strength can offer valuable insights into their overall health and help families prepare for potential future developments. Recognizing signs of social withdrawal and personality changes, which can indicate the body's preparation for its final stage, is essential. This shift in behavior, such as becoming more reserved or less interested in social activities, can be a subtle signal of declining physical health affecting mental engagement. For instance, 80-year-old James, once the life of the party, began withdrawing from social interactions and showing signs of disinterest, signaling a deeper underlying issue. If you find these insights valuable, please comment number 2 below to show your support. Don't forget to subscribe and turn on the bell to stay updated on our latest content. Your support helps us continue producing informative and inspiring videos. Let's continue by discussing social withdrawal and personality changes in elderly individuals nearing the end of life, as these shifts can offer significant insights into their well-being and preparation for the final stage. As time passed, he became more distant, leading those around him to realize that something deeper was unfolding. It became apparent that his declining health was manifesting through his withdrawal, serving as an initial warning sign. Medical professionals stress the importance of considering various factors when someone begins to detach from their usual social circles. Is it due to emotional distress, physical discomfort, memory issues, or part of a larger decline in health? Some individuals may disengage from conversations due to cognitive decline, finding it challenging to keep up, while others might avoid gatherings because of physical limitations that make them feel inadequate. Additionally, sudden changes in personality, such as increased irritability, anxiety, or confusion, may indicate an underlying medical issue like organ dysfunction, medication side effects, or early stages of dementia. These shifts in behavior are often overlooked or misunderstood, with loved ones mistakenly interpreting them as personal rejection rather than symptoms of a larger health decline. Recognizing that these changes are not intentional can help families respond with compassion and support rather than frustration. While social withdrawal is common among older adults, any abrupt or significant shift should not be disregarded. Providing gentle engagement, like short visits, listening to music together, or simply spending quiet moments together, can help maintain a connection without overwhelming them. Seeking medical advice, when withdrawal is accompanied by other warning signs, can help identify any underlying conditions contributing to the change. Understanding when a loved one is pulling away goes beyond social issues. It can serve as an early indication of significant bodily changes occurring. If a family member is displaying signs of withdrawal, view it as an opportunity to offer assistance and ensure they receive adequate care. One significant indication that an elderly individual may be entering their final stage of life is a decline in their immune system, often marked by recurring infections or slow healing. When the body's defenses weaken, it becomes less able to fight off infections and recover from minor wounds efficiently. This decline in immunity can present as frequent illnesses like colds, urinary tract infections, pneumonia, or skin infections that take longer to resolve than before. The immune system, acting as a protective barrier against harmful invaders, naturally weakens with age, leading to reduced white blood cell production, less effective inflammatory responses, and diminished tissue regeneration. Walter, an 81-year-old man previously in good health, began experiencing more frequent colds and prolonged recovery times from minor ailments. Even a small cut led to serious complications, illustrating his body's decreased ability to defend itself. Recurring infections in the elderly may initially manifest with subtle symptoms like fatigue, confusion, or a general feeling of being unwell, making it crucial to monitor any health changes carefully. Slow healing in older individuals can indicate compromised circulation, resulting in inadequate oxygen and nutrient delivery to damaged tissues, hindering the healing process. These signs of declining health, such as recurring infections and slow healing, should not be overlooked, as they can be early indicators of significant health issues. The presence of infections can be a sign of underlying health issues, such as kidney problems, undiagnosed diabetes, or early stages of organ failure. In elderly individuals, frequent infections, lingering colds, or slow-healing wounds may indicate the body is struggling with essential functions and may need medical attention. Making small adjustments like improving hydration, diet, or medications can help strengthen the immune response in some cases. However, recurring infections may signal the body is shutting down, prompting families to prepare for end-of-life care. Difficulty swallowing and loss of appetite are also concerning signs in elderly individuals, potentially indicating a decline in organ function or neurological conditions. Changes in eating habits can lead to malnutrition, weakening the immune system, and overall strength. Encouraging nutrient-dense meals and seeking medical advice for swallowing difficulties are crucial steps in managing these issues. Ultimately, a significant decline in appetite or difficulty swallowing can be a clear indication of a major transition in an elderly person's health. Understanding the reasons behind changes in an elderly loved one's mobility and balance can aid families in making informed decisions about their care and comfort. When a loved one begins to eat less or struggles with swallowing, it should be taken as a sign to provide support, ensure their comfort, and seek medical guidance to decipher what their body is communicating. Unsteady walking or frequent falls are often overlooked, but crucial warning signs that an elderly individual may be entering their final year of life. Although it is common for balance and strength to diminish with age, a noticeable increase in falls, difficulty walking, or sudden instability may indicate more serious underlying issues. When an older adult starts to struggle with movement compared to before, it may signify a decline in muscle, nerve, or circulation function. This physical decline is not solely about frailty, but can also indicate deeper systemic changes within the body. One primary reason for the increased risk of falls in the elderly is the gradual weakening of muscles and bones, a natural part of aging. This can lead to a condition known as sarcopenia, making daily movements like standing up from a chair or walking more challenging. Even those who were once active and independent may find themselves reliant on support to move around. For instance, consider the case of Frank, a 79-year-old who experienced a decline in his mobility over a few months. Initially dismissing it as clumsiness, he started stumbling more frequently, leading to multiple falls and a loss of confidence in his ability to move independently. Frank's family later discovered that his circulation was deteriorating, impacting his nervous system's response time. Balance issues can also stem from neurological conditions like Parkinson's disease, strokes, or dementia, affecting coordination and reaction times. Changes in the brain can disrupt the signals sent from the brain to the body, impacting balance and increasing the risk of falls. Additionally, poor circulation in the elderly can lead to numbness, weakness, and dizziness, further contributing to mobility issues. The danger of frequent falls extends beyond physical injury, as it can result in hospitalization or a rapid decline in health due to complications like infections or reduced mobility. Encouraging an elderly loved one to use supportive devices and consulting a doctor for underlying medical issues is crucial in addressing mobility concerns. Simple solutions like adjusting medications, improving hydration, or engaging in physical therapy may help restore stability, while persistent falls could signal a decline in the body's function. If you have found this information valuable, please comment below to show your support and consider subscribing to our channel for more informative content. Moving forward, another warning sign of an elderly person's declining health could be confusion, hallucinations, or cognitive decline, which are often misunderstood but significant indicators of potential end-of-life stages. This decline in cognitive function may manifest as forgetfulness, difficulty following conversations, confusion about time or place, or hallucinations, emphasizing the need for comprehensive care and attention to an elderly individual's overall well-being. A noticeable change in mental clarity, particularly when it occurs quickly, can be a sign of a more serious issue. The brain relies on a steady supply of oxygen and nutrients to function properly, and when the body starts to weaken, the brain is often one of the first organs to show distress. Cognitive decline can be caused by various factors, such as reduced circulation leading to oxygen deprivation, or underlying medical conditions like infections, medication side effects, or early-stage organ failure. In some cases, like that of 85-year-old Dorothy, cognitive decline may manifest as memory loss, attention issues, and confusion. Her family noticed her repeating herself more often and experiencing lapses in memory, eventually leading to hallucinations. Hallucinations in the elderly can be alarming for both the individual and their loved ones, indicating possible struggles within the brain. Other subtle signs of decline in elderly individuals include terminal restlessness, marked by agitation, anxiety, and disorientation. While some cognitive changes are expected with age, sudden or extreme shifts should not be ignored. Seeking medical advice is crucial if a loved one displays symptoms of cognitive decline, as they may be reversible or indicative of a deeper decline that requires preparation and care. It is important to understand that cognitive changes reflect the overall functioning of the body, not just memory loss. Recognizing and addressing these changes can ensure that loved ones receive the necessary care and comfort in their final months. By paying attention to these signals, we can offer the right kind of support and improve the quality of life for those we care about. Your thoughts and experiences are valuable, so please share them in the comments below. Thank you for watching, and we look forward to sharing more informative content with you in the future.